welcome to the KatieCares Veterinary Clinic. We're all about animals here, and I hear that your dog Lily is going through a tough time. And you have her here with you, okay? Give me a moment. I just have to get on my gloves, okay? Because I have to make sure that everything's gonna be okay with the germs and sanitization. So okay. Okay, Lily. Okay, Lily. Oh, wow. Okay. Wow. Okay, so this is a lot. Alright, I'm really glad that you brought her in. But I just wanted to start by saying that this is a lot. I already see some signs of mange and unkemptness here about her. She does not seem to be feeling her best. Do you, girl? Are you okay? You good girl? She's still a good girl. Yes, she's still a good girl. I'm so sorry that she's going through this. Why didn't you bring her in earlier? This seems like a very latent stage of whatever she has. This has got to be like stage 8. And I'm really sorry that, and I know I'm not sure what she has, and that's what we're here to discover, but when did she start experiencing symptoms? But right now, it's just gonna take some time, so please be patient, okay? I understand that you have you said a poker game to get to, okay, but I would urge you to take priority of your dog first. Lily seems like she needs your support today, so I'm gonna ask you not to leave. Is that the bar across the street? Okay. Alright, well, you know what? I still think you should wait. I still think you should stay here. You can talk to Adrian, our billing person. He's out front. I don't take care of the billing, okay? But we are going to be running a lot of tests, so I don't imagine that this is going to be cheap by any standards. But I think you're doing the right thing by bringing her in today. Okay. Oh. Okay, you're gonna go. Okay. You know what? I think that's for the best. Okay. I would like to actually talk to Lily privately. So I think that yes, go ahead and go to your poker game at the bar, and we'll call you. Okay. We're gonna call you when we're ready, and we'll see what's going on with her. Okay. So go ahead. And in the future, I urge you to. Okay, so in the future, I urge you to just bring her in earlier, and this won't take us long, alright? But I think right now our number one concern is Lily's health. Alright, bye. Wow. Okay, girl, okay. I'm so sorry. I know. It's okay. It's okay, girl. Oh, I'm so sorry. I know. But you're here now, you're with me. So we're gonna take good care of you today, Lily. Okay? Alright, Lily, don't worry, okay? You still got that spark in you. Okay, honey? Okay. Boop, boop. Okay. Boop. Alright. So I love you. Okay. I love all animals. So first, Lily, I just want to run some questions by you, okay? First of all, how are you feeling today? How are you? Not so good? I know. But is there anything in particular that you want me to pay special attention to? You're breathing. You're not breathing well. You're not breathing at all. Okay. Well, we're definitely going to check into that and get you breathing as well. I'm going to go ahead and write that down. Not breathing so well. Okay, could you verify your name and date of birth? Lily, okay, and your date of birth? You're not sure about the date, but you are about 46 in dog years, right? Okay, so this might be a time of menopause for you. So on top of everything that's going on at home, I think that you might be experiencing some early signs of menopause. it's a big hormonal change for you, Lily, okay? And so I just want to be here for you, for that. We might be prescribing you some hormones today, and also just some therapy, okay? Some therapy so you have someone to talk to besides me, and besides Matthew, your owner. It doesn't seem like he's really in tune to a woman's needs. No, not at all. Okay, so we're gonna make sure that you get that. We're gonna set you up with someone that can give you that feminine touch in the way that they listen to you and respond. Okay. Okay. So, do you have any allergies? Okay, so I get this a lot from dogs. Are you actually allergic to cats? Or do you not like cats? Because there's a difference. Alright? Because, I'll let you in on a little secret, Lily. Most dogs that come in here tell me that they're allergic to cats, and I run the tests and they're not. So, there's a specific cat that you don't like. That's what I thought, okay? And she lives across the street. Okay, so before you go on, we'll save this for therapy. Okay, before you go on about the cat, are you around this cat physically in the same room? No, okay. So you haven't been around this cat. You're an indoor dog. She's an indoor cat. You stare at each other across the window, and so there's no way that you would know because you're not breaking out into hives. I don't see any redness around here. Okay, and unless you're in the same room with this cat and you start having physical symptoms, I can't write down that you're allergic to cats. Okay, but I hear ya. Yeah, it can be tough. Those staring contests during the day. No one else is home. You just having a little face off there, aren't you? It's all right. It's okay. All right. Well, you know what? We're gonna table that. Any other allergies that you know of? Okay. That's okay. So you're a healthy doggy. Well, in terms of allergies, right? Okay. All right. So we talked about your breathing. Any preconditioned heart or respiratory problems? Okay, you just kind of stopped breathing a couple years ago. Okay. You're having problems with that. So that might be a big reason why this is affecting your appearance and loss of skin and things like that. A lot of times when we stop breathing, and this is a thing with humans too, when we stop breathing, all of a sudden, like over the course of weeks and months, we start to lose our skin. It's called decomposition. Okay, and it loses that pink color. It loses that nice little touch. And the same thing happens to your doggy fur. Yes, it does. So as the months progress, after you don't breathe anymore, your fur starts to fall off. Okay, and that's not you. That's not your fault. That happens to all dogs that stop breathing. Okay, but we're gonna see if we can get that back. All right. Okay, so you don't have any endometriosis or any pre-existing blood conditions? That's really good. Hypothyroidism, high blood pressure, not that you know of, because you're a dog, okay? Okay, well, all right. Any medications on a daily basis? Okay. None of that, that's good. So we might need to be putting you on a few medications today, so it's good to know that you're a clean slate. So what I'm going to do, I think, I'm going to do a complete head-to-toe exam on you today, Lily, and see if we can get you breathing again and feeling better. Okay, but first I have to run some tests and just check up to make sure that I nab the problem, okay? Because I'm very thorough veterinarian. All right, what's your pain level? About a 0. Okay. Numbness or tingling? You don't feel anything at all. Okay. Well, we're going to work on that too. We're going to be doing some sensations tests to check on that. But I do believe that this has been a struggle for you, and I'm so sorry. Okay. And looking at your overall appearance, I would say I'm just going to focus on your symmetry right now. Your head does look symmetrical. I don't see any signs of scarring. I don't see any contusions. I I don't see any skull fractures, and I can get a very good look. Thankfully, I can get a good look at your skull. I don't see any fractures here, just normal indentations that would indicate your age. But other than that, I don't see any kind of skull problems and bone problems that we need to be worried about. I'm going to be running some tests on your bones right now. I'm just going to be wiping, getting a little sample for the lab that we can send in for testing. Is that okay? May I do that? Okay, good. Okay. So first we're just gonna do. Oh, good job. Okay, good. Alright, we're just getting that skull sample. Under your jaw here. Hold your jaw. You're doing so good. Oh, okay. Alright. Whoa. Alright, don't worry. I don't need that sass. Okay, what I'm doing is I'm trying to help you, okay? So if you could close your mouth for me, okay? Okay, I understand that you don't trust me right now, and that facial expression you just made is a defense mechanism. And it's not what you really wanted to do, right? Because you really want love, don't you, Lily? Okay, but while we're at it, I'm just going to scrape your teeth a little bit for some DNA. Very good. Good. Good girl. Okay. What I'm going to do now is I'm going to palpate your head. Okay. I'm just feeling to make sure that everything's good. And I don't feel anything that sticks out in a symmetricality way, or if you have anything sticking out of your bones that might indicate that you're a Halloween dog, that would not be good. Okay, you're not a Halloween dog. You're a regular dog. You're a good girl. Okay. Those little eyes always get me every time. Okay, now I'm going to feel gently under the mastoid bone, and I'm going to ask you, are you feeling any pain here? Nope, still no pain? Okay. Alright, right here at the base of your skull. At the base of your skull, do you feel anything? Alright, I'm going to gently move back and forth, and you tell me if you feel any kind of pain. Try to resist my pull. Okay. Okay, good. Okay, you're doing great. Okay, Lily. Alright, so right now I'm gonna go ahead and put in your official report that your skull is not the problem. Your skull is healthy, intact, and actually very supportive to your lifestyle, which does involve a lot of putting your head around, so that's good. Okay, feel your pulse to listen for your heart rate. Okay. Okay, so I want you to just calm down. Just let me take the heart rate. Okay. Okay, just calm. Okay, good. So right now I'm feeling 0 beats per minute. And with your vital sign, could you uncross your tail? Uncross your tail for me. It's back here. Look, can I do it for you? Okay, uncross your tail for me, please. There we go. Okay, so I just want you to just breathe normally and relax. And now I'm going to take your oxygenation, okay? So that's me holding on to both of these. Alright, both of your little paws and listening to your breath against my ear and feeling okay. Okay. Alright, so at room temperature here, I'm feeling a 0%. So that is slightly abnormal. Okay, so I'm going to write that down, and that's something that we're going to do some checks on, but it's good that we caught that early, okay? Alright, so let me see. Alright, so now I'm going to listen to your heart, okay? So just relax for me. Alright, and breathe. Okay, good job. Just breathe for me. Breathe for me, Lily. You're doing such a good job. You're such a talented little creature. The way you stand, you just are so obedient. I can tell, but there's such a thing as too obedient, Lily. You have to learn to fight for yourself, okay? You have to learn to fight for your own little rights sometimes, okay? Your own little world. You have to advocate for yourself sometimes in life, because you're a little dog, okay? And don't let anybody take advantage of you, okay? Okay, so I'm not hearing S1 or S2, but the good part is that I'm not hearing S1 or S2, but I'm not hearing any other sounds that would indicate a murmur. So that's very good. At least we're not having a situation to where your heart is malfunctioning. Now we just need to get it to function in the first place, don't we? Okay, so I'm going to listen to the other side, which is the bell. And just the smaller side of the stethoscope is called the bell. So just stand and listen to me. Listen to your bell, okay? Okay. I hear a faint little something in there. Let me get in there, Lily. I just heard a flutter. Let me hear. Lily, I just heard a flutter. Girl, I think it might not be too late for us. I hear you. I hear a little flutter in there. Keep breathing for me, Lily. Oh, that was just a little dust mite. Okay, keep breathing. Shoot. Okay, it flew away. That's okay. We're gonna get you breathing again. Just because you're showing signs of not breathing doesn't mean that there's nothing we can do at this clinic, okay? And I did hear a little fluttering in there. And even though it was a dust mite, it was a good sign, it was a good omen that perhaps in the future we can be giving you that therapy. We can be bringing you back to consciousness. We can be bringing you to light so you can go out and rule the world like all the little dogs in your neighborhood, okay? So I can tell that you're a little anxious. So what I'm going to do now is just give you a quick petting, okay? Before we go on. Okay, good. That's a good girl, Lily. Such a good girl, Lily. You're so good. You're so good. Okay, I'm just gonna... Did you feel any pain there? Okay, good. So you have a nice, healthy, strong jaw. That doesn't mean you should be using it on anyone. That doesn't mean you should be using it. Close that jaw, Lily. Close that jaw. No. You can trust me, okay? You don't have to scowl at me. It's gonna be okay. Lily, I have a little secret for you. I know your owner's across the street playing poker at the bar, but you might not be going home with him. You might be going home with me, okay? Because I'm a rescue vet. And it looks like you might need rescuing today. Doesn't that make you happy? Oh, sweetheart. Good. I'm glad that you like to hear that. I'm so glad I do now. There's a quick brushing sensation right against your back. And if you could look at me and tell me which side of your body do you feel this on, okay? You don't feel it on either side, okay? Still don't feel it on either side. Okay, that's good to know. Let's check again. Okay, and I want you to breathe out. Very good, very good. Okay, I think there's got to be something wrong with my stethoscope because I'm not getting much right now. I'm not getting much. So, but that's okay, Lily. We're just gonna set this. We're gonna set that aside, and I'm gonna take a look into your eyes. Okay. Okay. How does that sound? Take a quick look into your eyes, and just check and see. All right. I am seeing no signs of pupil, no dilation. I am seeing a lack of cornea, iris, and eye veins. I don't see any tendrils that might be of concern. The one good thing is that you don't have an eye infection. Alright, you are free from eye infections. At least on that side. Let's check the other side. Okay. What's here? Okay, so I am seeing the socket of your eyes. The socket of your eye is very well rounded. I'm not seeing any signs of skull cracks here within the eye cave. I do see a cave in your eye. I see a cave, and I do see little swimmers in there, okay? Little swimmers. And that might be a cause for concern later on. A couple little floaty things in there. I think they might be little bugs. But you know what? We're gonna give you some eye drops, Lily. We're gonna get rid of those little maggots, okay? Alright, because you don't deserve that, do you? Do you, girl? No, you don't. Okay, baby. Here we go. Okay. So this is just an antibacterial eye drop. That's gonna take away some of that debris for you, okay? And so then we can get a good base of cleanliness with which to start. And then perhaps from that point on, we can get you starting to see again, because one thing that we do know about life is that it's a tenacious little bugger. You have the ability to regrow those eyeballs and eye sockets, okay? But you need a little tender love and care, don't you? Yes, you do. There you go. That's a good girl. Oh, baby. Oh, don't cry. Okay. Very good. Okay, so I'm already starting to see that you're looking better. I'm starting to see a little bit more confidence coming from you. And I like to see that, okay? Sometimes when we're not taken care of properly, we can suffer from a lack of confidence, and that can just bring down our overall well-being. So rather than prescribe you doggy SSRIs, I am just going to give you some tender love and care because that's what I believe in, alright? Oh, you don't have to thank me. Okay, so going along the lines of symmetry, I just want to make sure that your head is symmetrical, so I'm going to be measuring it right now. Good. Okay. 6 inches. 3 on one side to 3 on the other side. You are perfectly symmetrical, darling. You have a beautiful face. I'm just going to measure these paws right here. See what we have to work with here. Okay. And that is a perfect 7.5. So you have a good shoulder to paw structure compared with your head. A lot of dogs that actually are in kennel club dog shows, they vie for this kind of proportions. You have outstanding proportions in terms of dog shows, so you know what. And I know that you're probably not in a place right now to be thinking about that, but when you do get there, I want to strongly encourage you to enter in some of those dog show competitions, okay? Because I think you would be stellar. I actually show dogs, okay? So maybe we could work something out. I don't want to be pushy. I don't want to make you do something that you don't want to do. Alright, let's just be clear about that. I want you to be a little show dog on your own terms. Okay? But I look at you, Lily, and I see that show dog in you. I see it. I see that star waiting to come out. Okay, we just gotta grow some skin on you and get those eyes going again, and we can go to shows together. Yeah, they give you little treats and a ribbon. You just gotta walk on a little line and be happy, do a couple tricks. Okay, I can teach you all that. You don't have to worry about any of that, okay? So you can just relax right now. Right now is a time of healing. Okay, there's no doggy shows right now. There's no doggy shows. There's it's not till next November, so we have a whole year to prepare. Okay, and the one that I want to do is next November. Alright, so we have a whole year. And if it doesn't work out, it doesn't work out. You can still be my special doggy. Okay? My love for you is unconditional, Lily. Okay. Absolutely. Okay. So, I just want to check and see your tonsils. Okay, so next I'm just going to check and see what's going on with your tonsils. Yes. So, okay, so how are you doing? How are you? What kind of food did you eat when you were eating food? Okay, so you had eggs sometimes, and then other times you had cucanuba. Did you like cucanuba? I like cucanuba. Good girl. Good girl. So, oh, here we go. Okay, so just, now I want you to just kind of open your mouth. Okay, can I look inside? Okay, hold that. Hold that. Okay. We're just gonna take a quick look inside here. Okay, good. Okay, I see the roof of your mouth. It's a little dry. Your mouth's a little dry. So, but that's okay because you're probably suffering from some form of dehydration. Your owner probably wasn't as very conscientious about leaving the water out, the water bowl, right? Do you need some water? Let's get you some water. Okay? Okay, girl. You're fine. Good, Lily. Oh, she's thirsty. She's my good thirsty girl. Okay. Wow, you're really lapping that up, aren't you? Good job. Good job, Lily. Oh, I won't interfere. Okay, I think that's enough. Good job. That's a good girl. Okay, slowly dripping. Yes. Okay. So I brought you this ribbon because I thought when I've got this ribbon out, I thought you might like to try it on. Would you like to try it on, Lily? Oh my goodness. You look so stylish. That's a good girl. Okay. Should we have it like this? Make you like a little professor. Like you're about to profess. Okay. Speaking of that, now that we kind of like gave you the eye drops and everything, I want to give you a quick eye test. Is that okay? Okay, so how many fingers am I holding up? I don't see anything. How about now? I understand you can't count because you're a dog, so I'm sure that you do see there might be some action going on, but you can't count because you haven't been taught to count. Your owner didn't teach you how to count. That's a me, Matthew, isn't he? Okay. Well, let's check another way. So I want you to look at this test, okay? And see if you can read some of the letters for me. Okay, so I want you to read some of the letters. Why don't we start with this middle section? Why don't we start with this top one here? You see it? Nothing. Okay. How about this row right here? Nothing. Close. It's DHJBS. But you were right there. You were almost there. Okay. What about this row? Almost. It's FPH. Yeah, let me bring it a little closer. Let me see if you can read it a little closer here. How about this row again? No, you don't see anything. You just see utter black pitch darkness. Okay, you know what? That's okay, we can work with that. Can you tell me what color this is? Red. Great. You know your colors. Is a good thing. That's good to know your colors, little girl. Okay, and this one. Green. Wow. So I'm going to put on your chart that all of your results have come back negative, but you do know your colors. So that's one good thing to know, right? If there's one thing in life that we need to know, it's what color is what. So that's good, okay? You're doing really good. Okay. So, alright, and are you wearing contacts today? might be an issue. What we're gonna do maybe is I'm gonna set you up with a pair of trial glasses just to see if that helps at all. You're reading your letters, okay? Because it's important. It is important to read your letters, okay? Right now, so we're gonna go ahead. We're gonna fit you with some glasses. These aren't exactly the right fit, but I think they will. Go ahead and face this way for me so I can check the size of the rims. Okay, I see right here. Okay, so we're gonna have to send those glasses probably back to the lab to get you fitted better. But right now, I want you to wear them and see if the prescription works for you. Okay. All right, we're gonna go back to the chart and see if you can read some of these letters better. All right, let's start with this row. Okay, it's still nothing. Okay, what about this row? Okay, and this row? Still no letters. Still no letters. Okay. Okay. You know what? Sometimes the prescription takes a while to work, so we're going to wait until the prescription perhaps can work better. Okay. And then we're gonna table this and come back to it because I do feel like those glasses, my professional opinion is that they're gonna be good for you in the long run. Okay. They're gonna, and aside from the glasses, we're gonna fit you with some contacts for the dog show. Okay. Because then we're not gonna have you can't be a show dog with glasses. We're gonna fit you with contacts, but I do have that. I do have a veterinary eye clinic that I can send you to, and I'm the technician there as well, so don't worry about anything. We're just gonna get you all squared away, okay? I already see that you're starting to shine a little bit better. I see your little personality starting to peek through, so I'm so happy to hear that. I'm just gonna give you a little petting now. Okay, good job. Good. Okay. Do you feel that on either side? Equally nothing on both sides, okay? Okay. It's okay. Okay. Okay, it's okay. You can just try to chill out, Chill out. I know it's been a hard day for you. It's been a lot. You're not used to getting this tender loving care, are you? You're not used to a little spa day. But this is so much more than a spa day. It's a medical checkup. You look so good. So good. It's been a big long day for you, Lily, but I can already see that smile on your face. Okay. I got you some prescription glasses. Got you this new little scarf to wear. And I gave you some eye drops to regenerate the cells in your eyes. And soon I think you're going to be breathing in no time because you got that extra special attention. Those brush strokes that I gave you really regenerated your cells whenever I bit you on the back. Okay? And so I think your heart's going to start picking up again soon. Don't drool. Okay, good girl. Okay, so I'm setting you up with a therapist on Better Bark. Okay? And so that's a telehealth. So when I'm at work, okay, I'm going to set you up with an iPad and you can talk to a certified therapist who specializes in menopause for canines, okay? Alright? And so that's going to be your exit, okay? And I'm going to set you up with some antibiotics to help with those little buggers in here. I'm going to take you home and you're going to be my little skeleton puppy. My little skeleton creature, okay? You're not going to be anyone else's, okay? I think that you're just so beautiful, and I hope to show you in a dog show sometime. But, yeah, let me take you home. Let me show you around, okay? So why don't you come with me? You can get in the car, and then I'm gonna dog nap you today. Let's call it what it is. I'm gonna dog nap you, okay? But I do this in certain circumstances when it's the right thing. I do the right thing, Lily, and you're gonna come over. You're gonna be such a good dog. You're gonna be such a good dog for me. You're gonna get lots of water, lots of treats, and I'm gonna nurse you back to health one day at a time. Okay? Okay, I do have a Tibetan Mastiff at home, but he's very friendly, and I'm sure he'll take to you just fine, okay? Alright? Yeah. He might try to give you a little love bite, because he only likes chewing on bones, but he's harmless, and he'll show you around, and he can show you how to use the iPad, because I already showed him how to use the iPad. His name is Nigel. Okay, so you can get to meet Nigel, and we can all be one happy family. How does that sound? How does that sound, little girl? How does that sound? That sounds like a good idea. Yes, it does. Okay, alright, come with me. Alright, and your appointment is officially over. Yay!